So this concept of bone marrow, stromal and other cells interacting with tumor cell has been an important one in all blood cancer. For example, in multiple myeloma, this interaction drives tumor cell growth. It leads to drug resistance. It leads to progression and expansion of the disease. And because of the drug resistance, this interaction also prevents curative outcome. Similar principles do apply in Waldenström as well. The plasmacytic component and the B cell component, they interact with stroma, and there is significant data over years that suggests that this interaction leads to development of a bone marrow niche where tumor cells might be protected. It leads to production of number of cytokines, which might be driving the disease and also causing some of the immunosuppression. And so now targeting this interaction becomes an important therapeutic concept. And once we can find drugs that interrupt this interaction, we can also develop combination to be more effective. This has been done very successfully in multiple myeloma, and that's how newer drugs have come about, and that's how combination has come about. And exactly similar pathway is being followed for Waldenström to develop new and next generation of treatments.